It always shocked me that a 5-year-old would be so scared of the dentist. Usually that comes from a parent making a comment. Why are you scared? You're 5 years old. You've never had a bad experience at the dentist. There's no reason for you to show up to this doctor, but not to the other doctor and be petrified.
I'm lying there in the chair. I'm completely frozen. I can't feel a thing. He puts the thing in and starts to do the thing. And I'm like, you have to stop. I started crying.
It's a weird profession. We are the few that really get into the bubble.
This is Skin Talks, the podcast where we go deeper than skin, products, and trends and explore the conversations that actually matter in health, beauty, wellness, and confidence.
We're a mother-daughter duo and the founders of Boutique Skin Envie. After years inside the industry, we've learned that health is never just about what you use. It's about everything you digest, how you think, how you live, what you eat, how you move, what you put on your skin, and how you feel in your own body.
If you're looking for insight, honesty, and a fresh perspective on the future of health, beauty, and wellness, you're in the right place.
Let's get into it.
Skin Talks podcast by Boutique Skin Envie, hosted by Beate and Natascha.
We're so excited to be welcoming back Dr. Joe Scalia. This is his second time on Skin Talks. Today's conversation was so amazing. We really got in depth about the teeth, your teeth health and longevity of your teeth health throughout your entire life when you start growing teeth in your womb for your little baby and all the way to elderly. We really got into confidence, the aesthetics of teeth, prevention, and overall well-being. So welcome back to the podcast, Dr. Joe Scalia. So welcome back to the podcast. This is the second time that we're having you on, which is very exciting. And I'm excited to really learn a little bit more about dentistry. As you guys may or may not know, Dr. Joe is my boyfriend and baby daddy.
Baby daddy.
Thank you.
And I'm excited for this conversation, mainly because we spoke about this before we started recording, but we really want to talk about the health and longevity of teeth throughout your life. And I mentioned that, did you know that I'm already growing the adult teeth of our future child?
Do you know what week in your pregnancy you began to form the adult buds?
Yeah, 8 weeks.
There we go. Good job.
Incredible.
You learned that from Dr. Joe, didn't you?
Yeah. But before we get into this, and I think this is a really important conversation, I want to know a little bit of a backstory, or for our audience to know a little bit of a backstory. What brought you into dentistry? Was it like something you always wanted to do as a child? Tell us a little bit about that.
Actually, it was interesting. It was a moment I remember pretty clearly. I was 13 years old. I got a tooth extracted and I was in so much pain. And I remember crying a lot. And I told my mom in that moment that I don't want anyone to feel that kind of pain. And then I decided to go into dentistry pretty much from that day on.
Wow.
That's pretty early. Because I feel like when you're a kid, you often, I wanted to be a veterinarian. Yeah. Very typical though. Like you could see me being that.
Yeah, but you also wanted to be a brain surgeon at one point.
I remember that because of Jean-Marie.
Yeah.
But yes, you go through different stages. So the fact that you actually pursued that is pretty impressive.
Mm-hmm. I went astronaut to dentist overnight.
Okay. Interesting. But your family is also, your brother's also into dentistry also, right?
My brother kept more his desires to himself.
Okay.
Drove through the sciences through college and university. And then at that moment, once you're high up there in the science world, there really is a decision to make. Are you going to do a Master of Science? Are you going to go into medical school? Are you going to go into dental school? And my brother, 3 years older than me, got accepted into dental school. And then I only applied to dental school. So it was a bit more. Okay,
so you were clear from a very...
Yeah, it also helped. It was kind of cool that he was in it before me, but we had taken our own paths to that, to reach that goal.
Mm-hmm. I love it. Mm-hmm. It's very cool.
It is.
So let's get into babies and teeth. So like you said, I'm growing the baby's teeth already, adult teeth, right?
The buds, yeah.
The buds of the adult teeth.
Mm-hmm. The shape of them is already there.
Okay, so when the baby is born, at what point, at what age do babies start growing their actual teeth? Like when do they start teething? At how many months?
Usually the 6-month mark is a good barometer where we should see the first baby teeth coming out. If it's a bit before the 6-month mark, like at the 5-month mark, then we could assume that the adult teeth will come a bit early also. And if it's a bit after the 7, 8, sometimes even you could go up to a year sometimes, and some parents don't, it's rare, but parents do panic a bit at that point. But at that point, then we could also say, well, at 6 years old, when the baby teeth start falling, then maybe this child might have their adult teeth coming out more towards 7 years old, 8 years old.
But like
Happens.
you said that if they're not coming at 6 months, they might be panicking. Like what is like, is it possible that they're not going to grow baby teeth, or like do all babies grow baby teeth?
Usually, I would say upwards of 95% of the time, all the baby teeth are there. So you could have a congenitally missing adult tooth, but I rarely see a congenitally missing baby tooth. Something I should
My
check,
brother
actually.
had 3 teeth. Like not all of them, but he had his baby tooth that fell out. Then he got another baby tooth and that fell out. And then he got his adult tooth in the front. It was quite interesting when he was a
What?
kid.
Really?
Yeah. Yeah. He had 3.
You could have
And
extra
one
teeth.
came in very far in behind. So I mean, there are definitely exceptions, like anything in life, right?
Cernary teeth, like extra teeth is common.
Interesting. And so when the teeth start coming in, like
It's painful for babies, eh? They really struggle
Teething,
with that.
yeah. Very, very painful.
I think why it happens maybe at such a young age, because it's something that they don't remember. Is that like a thing?
Well, funny enough, sometimes I'll have an 18-year-old come in and be like, oh, I'm in so much pain on my bottom right. And I'm like, I look in the mouth and you see that like the wisdom tooth is just like slowly popping out of the gum. And you're like, you don't remember this, but when you were 6 months old, you had pain like this. And when you were 6 years old, you had pain like this. And when you were 12 years old, when the second molars come out, you had pain like this.
Yeah.
You don't
Teething
remember
is
it.
Teething is a painful moment as the tooth exfoliates through the gum.
And then, so like, what's the care when you get like the 6-month mark or 5 or 7, whatever it is, when the baby teeth start coming in? Is there anything that you do? Do you start brushing the teeth? Like what do
What
you
is
do?
best practices
Yeah.
for that?
6 months a bit early, but usually when the baby will be crying a lot on teething, some parents use Oragel when it's pretty bad. It's something that's sold at the pharmacy over the counter.
Numbing. It's like a numbing
Yeah,
thing.
it's sort of a numbing thing. It helps a bit. Tylenol sometimes parents will use, but if not, it's just more of a process. You just got to get through it.
Yeah.
I
I put stuff on your gums when you were, and there's also, they had these like gummy toys that you can, the
Yes,
baby
there's
can
like a
bite
gummy
on.
toothbrush that babies can
And
bite
they
on
bite
to
on
help.
it, and you put it in the freezer, and it kind of helps to divert the. I don't think it numbs the pain really, but it probably just
It just
diverts the
helps.
attention, right? It eases it a little bit.
I mean, we're gonna learn what a crying baby implicates.
Yeah,
But I'm
so exciting, so exciting.
And then, so like, okay, so the teeth come in, and then when does the dentist come into play? When do you come into play into a child's
Well,
life?
first of all, before that, I want to know, when do you actually start to brush teeth? Like, what is it? What is the?
So I recommend, to each parent, it's a bit different. What's a bit easier and not. But kids are very habitual, and humans are very habitual, right? So once you start the process of understanding, or even if the baby's just watching you brush your teeth and then you're slowly brushing the baby's teeth, I would recommend by like 1 year old, when the baby has all of its baby teeth, you should at night be brushing the teeth
To build good, healthy habits.
to build a healthy habit.
Yeah.
I mean, there's not really an issue with regards to, I mean, usually baby teeth are a bit more spaced out.
Mm-hmm.
So when we're talking in between teeth, interproximally, where most adults get their cavities due to lack of flossing, for baby teeth, that's not really an issue, right? We're not going to start flossing a 12-month-old
No,
baby.
because there's too much space in between. Plus, their diets are very different. I guess it's when you start to introduce more solid foods and stuff like that.
Exactly,
Meats
for
and
sure.
proteins and.
And but it is a thing. There are babies that do get baby caries from mother's breast milk. Sometimes some parents will be giving breast milk late at night, and also like if you're not cleaning at 2 years old. Sometimes we see some babies that have a lot of cavities, but it's rare that we're even doing a checkup then. But usually a parent will see like blackness on the teeth, have us check it out.
Back in the
You have to get it
day-
removed?
No, sometimes we'll send, at that age, we'll probably send to a specialist. So there's pedodontists that are specialized just in children.
Mm-hmm.
And at 2 years old, they have different techniques that, at the worst case, do general anesthesia and you take care of all of them. But
It's rough, but I remember back in the day, there was a really big thing because parents would give their kids bottles at night.
yes.
And sometimes, it wasn't milk. Sometimes it was like diluted apple juice or, and the child would be drinking, falling
Huge problem.
asleep. And then the teeth would start to, I remember that, or even Coca-Cola and stuff like that. Like a tiny bit of Coca-Cola in bottles. I mean, the things that they used to do back in the day, even if a baby was crying or something like that, they put like a drop of whiskey into the bottle, like that'll help the baby fall asleep. No, these things were done. I swear to God, this will not be done with
That
my
explains your
grandchild.
generation.
Tash, would you like to do that?
No.
Okay.
No, but I'm also curious about something else. So there's obviously different brushes for babies that are much softer and more delicate for the mouth. But why is there a different toothpaste for babies and young children versus adults?
Because a child is more likely to swallow.
Oh, okay.
So the reflex of spitting, and maybe if they like the taste of it, like you really don't want a baby swallowing, ingesting the adult toothpaste,
Okay.
which could have famous fluoride in it, which could be harmful
Makes sense.
to a baby. You don't want a baby ingesting toothpaste in general. So they put
No.
a much safer, cleaner toothpaste for children, because the importance for a child, like I said, is much more habit and like cleaning the surface of the teeth. And also it's teeth that at 6 years old are falling out. So it's a different process, because if it was teeth that we're
Permanent.
keeping for the rest of our life, there's a different,
needs. The needs are
the
different.
needs are different.
Yeah, I think so. If I understand correctly, this whole thing is about building healthy habits for children starting at a very young age. And also, I think it's a prideful thing. If their mom and dad are doing it, or their parents, they're going to want to do it too, right? So it's kind of a special, I get to brush my teeth kind of thing.
Yeah.
So I think every dentist really handles children a bit differently, but I apply that habit also to the dentist chair to try to get the child, because it always shocked me that a 5-year-old would be so scared of the dentist if he, like, it doesn't really make a lot of sense. Usually that comes from a parent making a comment.
Yeah.
Or someone in their entourage making a comment towards the dentist, like, why are you scared? You're 5 years old. You've never had a bad experience at the dentist. There's no reason for you to show up to this doctor, but not to the other doctor and be
No, but definitely
petrified.
parents influence. Like, how many times do you hear about a parent that says something like, I hate mushrooms, and their children hate mushrooms,
Yeah,
or I
100%.
hate tomatoes and the kids hate tomatoes. It's just automatically it's like you're leaning into that. But I remember when you were a baby, I approached it really differently. I always said to Tash, oh my God, you are so lucky, because today you get to go to the dentist. And you would be like, oh yeah, I get to go. So I don't think you ever had a terrible fear. You just didn't like the fluoride. I remember you freaked out about the fluoride.
Yes. And there was an association with this one dentist. The moment it was on a second floor, and the moment I opened the bottom floor to go into the staircase into the dentist's office, I immediately had a
Salivation, like,
no, it was like a stinging in my mouth. Not a stinging, but like a fuzzy feeling in my mouth, and then an upset stomach ache. And I'm assuming that's because I had swallowed fluoride. The one, like, it was like the thing they put in the tray, or I
like
might
that
have.
foam.
Yeah.
So you have to hold it for like a minute or 2 minutes and then spit it out.
And then I think I might have swallowed it. So it gave me a tummy ache, because I've swallowed mouthwash before, and it's given me a stomach ache. And I think from that moment on, when I was young, the moment I opened the door and I smelt the dentist's office,
it's normal.
I immediately had this foam, like this weird feeling in my mouth, and then also in my stomach. And from that, I was like, I don't enjoy this at all, because it was a negative experience that I had that like threw me off. And then when I went to a different dentist's office after that, because I was there for, I don't know, 15 years or 16 years. After that, I never had that feeling again. So it was like association with that one
with
smell.
pain.
So your new dentist
but I had
doesn't cause
stomach
you
ache.
an upset stomach?
No.
You're the new dentist? I'm still trying to get an appointment.
We're trying to fit you in. We're
I'm
trying.
getting fit in
Very
here.
busy.
So then going back, like you would say, like, when do you start? How do you avoid having a child fear the dentist? And like, what's your process in that?
And what age should they ideally start?
Yeah. So what I usually tell a parent that's been a patient for a while, or as a friend or whatnot, is I would want your child to come with you when they're 3 years old. Sit on the chair, watch your cleaning. At that appointment, they'll understand. They'll watch what their mother's doing, maybe play a little game. Usually the staff will be like talking to them a bit, give them toys, and then they leave. At 4 years old, same thing. You come with the mother, you sit down in the corner, you watch what's happening. And then at 4 years old, sometimes I'll just count their teeth and then do like a 1, 2, 3, 4, 5. But really, I'm just looking quick if I see anything that could be problematic, and then give them toys. And that gets them excited for their 5-year-old appointment, where they could sit down, we can do a cleaning. And at that point, like, I find that I've been doing this now for 12 years and it's worked pretty well. And most kids really want to come back with me and are not scared. It just gets them excited for their turn.
Yeah.
And then when they get their turn, they're much more cooperative with the hygienist. They'll keep their mouth open even though they're not super comfortable. It's
you break them in slowly, making it a positive.
It's a weird profession. We are the few that really get into the bubble. Mm-hmm. We're in the bubble.
Yeah, you're in the mouth.
Like, in the mouth, in the face.
That's insane. I have a high respect for it because I don't think I could do that.
No, you could definitely not do that. But I think about that often. Like when we first started dating, I was like, oh, like, there's like obviously intimacy, but then I went to go see you as you're my dentist. And I'm like, wow, this is another level of intimacy where like, he's literally in my mouth. Mm-hmm. Like not many people experience that. It's a very interesting experience to have your significant other like in your space. And I'm assuming it's probably the same if you're dating like a gynecologist or like a certain kind of doctor or somebody where like you're physically in their space.
And it's also a vulnerability. There's a vulnerability about it because you're at the mercy of, right? So it's,
yeah. I remember being like, oh my God, what if my teeth are like so dirty? Or then I was like so paranoid the first time I went.
It's a deal breaker too. Like,
oh yeah. Yeah. Okay. Well, we're here.
So disgusting oral hygiene. I'm out.
So ultimately, so you bring the kids to, they have their first dentist appointment at 5.
At 5, usually will be like pretty much a full cleaning. And then at 6 years old, we usually see some movement in the incisors. And sometimes they'll have a tooth that fell or whatnot. And we're usually able to take all full x-rays at 6 years old, which is good because you want to know if there's a congenitally missing tooth. You want to be able to prepare. You want to know that all the teeth are there. And so usually x-rays will be at 6 years old.
So it's important to see a dentist at 6.
Oh, by 6 years old, I'm even late. Most dentists will even tell you, like, my system that I just described to you is much more, is very different, much more lenient than most dentists would recommend.
Well, you're trying to also build the relationship with the child, right? And
which I think is more important than the care, is the relationship. I take that across with all of my patients. I think the relationship factor, because of the intimacy, because of the bubble, because of the way our world is now, in terms of social interactions being very, very different. A lot of people go work from home. A lot of people do Zoom calls. A lot of people rarely have human interaction. So when you're popping into the bubble, I think relationship is much more important than the professional care.
You go in as a 5-year-old, 6-year-old, you have good experiences, blah, 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 blah. Like, where does the anxiety and the fear at a later life come into somebody's life? Like as an adolescent or even as an adult, like there's so many people that are afraid of the dentist, hate going there. Where does that come into play if let's say they've had the perfect experience of going to the dentist at 2, having their 5-year-old, 6-year-old dentist appointments? Like where's that disconnect? Because ultimately it should flow naturally. It's probably pain related, though, I would imagine.
It's usually pain related. Often it's also stereotypes in the sense that you could be watching a TV show, a kid's show, and they'll talk about the dentist. You could be, with regards to, there's expressions, it's as hard as pulling teeth. You know, when you say it's as hard as pulling teeth, and then it's your moment to have a tooth extracted because the orthodontist said you got to extract a tooth, and they're 7 years old and they have to put in a palate expander. And there's things happening with regards to this stereotype of the dentist being painful. It's also, it's a weird feeling when you get a tooth extracted.
I have to tell you, I've had a lot of stuff happen to me with my teeth, but during the pandemic, I needed to have a tooth pulled in the back. And so usually it used to be when I was growing up, the dentist did that, but it wasn't the situation. I had to go to a specialist to pull my tooth because not all dentists pull now. It changed along the way and I wasn't aware of it. But anyways, I've had a lot of work done in my mouth over my lifetime. I'm lying there in the chair. I'm completely frozen. I can't feel a thing. He puts the thing in and starts to like do the thing. And I'm like, you have to stop. I started crying. I was just like, I started crying. I felt so like vulnerable and alone getting this stupid tooth pulled out of my mouth. And I had no pain.
With someone you didn't know.
Someone I didn't know. They're in my mouth. Like it was really a moment. I had to make them start 2 or 3 times over. And I'm not
When was this in Vancouver?
No, that was another one. I had to have a root canal done there. And that I was like, that was easier for me, a root canal. And I saw all these long things going in my mouth and I was having a heart attack. But getting a tooth pulled, really, really, I had to stop. And I'm not that type of a person. I don't cry easily anyways, but I had to make him stop. And he was starting to get impatient with me. And he says, well, if we're not going to do it today, we can't do it. And I'm like, no, we're going to do it. But it was a moment that I had ultimate weakness and I don't know why.
That's weird.
You know?
It's 2 different feelings. There's an upper tooth on the maxillary is spongy bone, and it's also the bone that is the base of your crane. So you're gonna be frozen, but you're gonna feel some sort of
uncomfortable
crack, and it's uncomfortable. For a lower mandibular tooth, a lower jaw, when it's like really, really well frozen, you're not going to feel much. You're just going to hear some cricks and cracks.
It's that too. It's just the whole
the hearing, the drilling, the pressure, all of that. It's definitely, I think also because it's so close to a lot of your, like most of your senses, except for your touch,
your ears,
your smell, like all of these things. It's such a like scary situation because you have sounds, feelings, pressures, like
it's
smells.
Unfamiliar.
There's ways to minimize it. I tend to play music rather loudly. I'll sing.
You sing
if I have to.
Well,
you'll talk.
I'll talk definitely.
Well, definitely Joey will talk. I could see that happening.
But it's important for the patient to feel at ease. You know, like sometimes just going to a specialist. The specialist has done it hundreds of times and obviously has much more education than the general dentist and is probably better suited to have removed that tooth. That's why the dentist sent you there. But you see, you emphasize my point, how the relationship is so much more important than the act, the professional care, because you had no relationship with that dentist.
And I think it's just the bedside manner. Like, I'm just going to take it out. We're going to put you, we're going to freeze you. And I didn't know what was happening. They don't, it's kind of like maybe managing expectations along the way. So I'm going to do this, and then we're going to do this, and then we're going to do this. You may feel some pressure, blah, blah. You got to talk the patient through the process, I think.
I never extract a tooth if I haven't met the patient before. So there's no other doctors doing the diagnosis coming into my chair. If it's an extraction, I'll usually meet the patient again for a consultation before, have them feel comfortable with me,
You're building
understand
the
me.
Yeah. Let's talk about Alea, conscious period care. At BSC, we believe wellness goes beyond skincare, and it's about everything we put in and on our bodies. That's why we chose Alea. Most period products are made with plastic dyes and synthetic fibers that can disrupt our health and harm the planet. Alea offers something better. 100% organic cotton, fully biodegradable, and designed with your body in mind. It's a small, conscious change that supports both women's health and environmental responsibility. Try Alea at Beskin Envie, that's BSKINENVIE.ca, and use SkinTalks15 for 15% off your first order.
Why would somebody get a tooth pulled, and how can you prevent that, let's say, from happening?
There's different generations. For example, someone who is a 50-year-old today began getting care 40 years ago. A lot has changed in 40 years.
Massive.
And so a 20-year-old today that started to get dental care on his permanent teeth 14 years ago has much more likelihood of never getting a tooth extracted. But there's also wear and tear, right? If you eat 3 times a day, then you go through a stressful moment where you're bruxing, grinding your teeth, and then you're eating 3 times a day every single day, 365 days a year, times 40 years, the teeth are getting a beating.
They are getting a beating. And I can tell you, like, another thing that happened to me was I was at my office, this is years ago, had a massive fight with my father. And I think I clenched my jaw so tight that I broke a tooth, because that was when I flew to Vancouver the next day and I had to go straight into emergency and have a root canal, and like it was a disaster. But I'm sure it was because of that. So
for sure.
when you're under a mass amount of stress and you're angry or things are happening, and like you said, the wear and tear on your teeth over the years, it can happen that you break a tooth.
And enamel is extremely, extremely strong, but you use it a lot. You know, you crunch some nuts.
So then, like, how would you, let's say for somebody who's, let's say my mom, who's had her teeth been taken care of for the past 40 years, how do you maintain, like, how would you make sure that she has a strong, healthy tooth after all these years? But wear and tear is inevitable, obviously, but there's probably some factors you can put into your daily routine that will increase the strength of your teeth.
The strength, yes. I mean, also when a tooth starts to get worked on. So let's say between your first molar comes out at 6 years old. That's the tooth we mainly eat with. When your first molar comes out and then gets a cavity in the first 5 to 10 years of it, you get your first repair. You've started the process of weakening this tooth, because you're drilling it, you're filling it, and now they're coming out with many different techniques how to be much more conservative, and which cavities need to be repaired and which can wait. And now we monitor much more cavities today than we did even 5 years ago, 7 years ago, 10 years ago. Since I've graduated in the 12 years, we've seen a manic shift towards preserving and being much more conservative with regards to it, because 40 years ago they would do gray fillings, and the gray fillings, amalgam fillings, are fantastic. They last 30-35 years. We've been doing it for 70 years. However, in time they
leak,
expand.
And they also don't they leak too? Like, don't they leak into the bloodstream? No. Okay, that was a myth. We busted a myth, people. I love that. I love that.
They expand a bit, and then that eventually makes your tooth much weaker.
Yeah.
And then a tooth will usually break.
Which just happened to me.
And then you could need a root canal or you need a crown. And this is big damage done to the tooth structure. And if you don't have enough tooth structure, well, you can't do repairs. So sometimes, it's not just about avoiding extraction. Sometimes extracting a tooth and putting an implant in is the best thing that you could do for your jaw. Because you wonderful ladies are the skin queens, and when you lose a tooth and you begin losing bone structure, well, then what happens was, when you don't use bone, you lose it. So then your face starts diminishing, and then once the skin is affected with wrinkles, and then we try to fix it with Botox, and then this, and then that, and then we try to regain the facial aesthetics associated to that tooth loss.
Wow, that's it's so true. I didn't make sense. Totally makes sense. I didn't think about that really, but yeah.
It's all bone volume. It's all bone volume.
And you lose your bone volume as you get older already.
Yeah.
Especially in women.
Yeah. After menopause. Like during
pregnancy.
Really? You lost bone?
Am I not? I'm like,
I'm not sure about that. A lot more blood, but I don't know
your
about
bones get softer.
Softer, but you
don't quote me on this, but apparently also the baby takes so much calcium from you. So you get weaker throughout the... I actually listened to a podcast, and it was, I can't remember word for word what it is, but the baby takes so much of your calcium and takes a lot of your bone density to grow. And then even after, like, let's say 6 to 9 months or something after postpartum, like, it's so important to keep your calcium up to maintain your bone strength, because you get smaller even postpartum because you're so weak from what you've just built.
But you have to be careful with calcium too, because my doctor told me that if you have any history of heart issues, taking too much calcium in your life as a woman, I don't know about a man, is actually dangerous for heart. So I don't know. I don't know if all this is accurate, but it's things to think about anyways, things to think about.
I think like overall health, which is why we have this podcast, like overall health and well-being is so correlated no matter what. Like how you just said, how the wrinkles in your skin and your face are going to look can depend on if you've lost teeth, which could depend on maybe a disease or this or that. Like it's so correlated, everything in your body.
Yeah.
So like having this 360 approach is very important.
Which I find also, just to go off on that a little bit, dental hygiene is so important. And, we're lucky if we have medical medical insurance here in Canada that you can see the dentist and have probably 80% of it is covered. But let's say, for example, when you look at my brother who didn't have medical insurance and started getting all of these problems with his teeth, we're talking like $10, $12, $15,000 of minor repairs that are major repairs actually and very necessary. But a lot of people can't afford that. So
That's the problem.
That's a huge problem actually. That's a whole other discussion. But
when you start working on a tooth and you have a filling, and every year it's just what isn't going up in price. But you want to preserve your teeth. You want to do what's best. So the diagnosis now is becoming the most important. Like we described how a great filling is taking expansion. It held for 40 years. The patient is 45 years old. Now the tooth breaks. Like, is it better to invest? What if they can only afford one thing, right? And the tooth breaks. Now, are you going to go with a root canal, a post, a core, and a crown, where you're roughly spending upwards of $4,000 on the tooth? Just one tooth.
I know it's really a lot.
Yeah. Or are you going to extract it and then put an implant in and then a crown in the implant? And once that implant fuses with your bone, screws normally there forever, barring a complication or a infection that could affect it. But is that a better place to put $4,000, or is it better to try to save the tooth? So these are our constant discussions that we have as a community, the dentist, to know what is best. Is it sometimes going for the extraction, as much as we want to avoid extraction, sometimes going with the extraction, doing the implant might save the patient from having to pay upwards of $4,000 or $5,000 twice for that tooth, right?
It's a big question, and that gets us into, what if the patient can only afford the extraction but not the implant? Then we're dealing now with self-confidence, right?
Extremely common.
You lose a tooth, it's brutal. I know my brother's gone through it because he knows, I've got to lose this tooth, or I'm going to lose this tooth, and to put an implant, and it's going to cost me this. And it's like calculations. You have kids, you have families, you have mortgages, you have all of these things.
It's an extremely common problem. I deal with these discussions every day because when you have an infected tooth that needs to be extracted,
it has to be, because it's
You can't
very
avoid
bad
it.
for your health.
we can't leave that active infection and that evil bacteria
in your body
chewing away at your bone. You can't.
Because ultimately, that infection could lead to other things,
other
in your body.
complications,
Like, what other
and
issues
illnesses
would you see? Like, let's say I had an infection in my tooth and I didn't. Well, I probably would
or you
know,
didn't do anything
but I didn't
about
do
it.
about it. I put it off for a couple months or whatever, and I was like, let me just wait. Like, what are some of the consequences of that?
I mean, so first off, you'll go to the dentist because you have a pain. That's how they'll see the infection.
And it's always very painful.
Very painful. Then you'll see the dentist will diagnose the infection. He'll give you antibiotics to calm down the infection. But the source of the infection is still there until you extract the tooth, because it's coming from the dead nerve in the canal where the nerve was. And sometimes it could happen also after a root canal and whatnot, but that bacteria is violent. And then that bacteria could travel into your bloodstream, will travel into your bloodstream, and could cause heart disease, could cause someone with diabetes to have trouble controlling their sugar. There's so many effects.
Yeah.
It's hard to track what it's going to lead to, what it's going to cause. I mean, it could cause acne, for all we know.
Yeah, no, there definitely, it's very dangerous. The mouth is filled with.
You just can't leave it there. And then sometimes, you'll give a patient antibiotics and you tell them when the pain goes away, you still have to extract the tooth. But obviously, sometimes they don't come back. Sometimes they can't even afford the extraction appointment. And then they'll come back 6 to 10 months later and they'll have a big infection
abscess or something.
Big abscess.
Yeah.
And then at that point, you have facial cellulitis. If it gets worse, you have to go to the hospital.
Well, yeah, my mother had that too. If your infection starts to move up or down, you're in big trouble. You have to get it out. I remember one time she had an infection in her mouth, and it was you could see it was going up to her eye. And yeah, she had to. She needed intervention more than just a dentist. She has to go to the hospital because it can really.
Yeah, so that's going
dangerous.
up, and if it goes down, it could block your airways.
Yeah,
it goes down, blocks your airways, you can't breathe.
Yeah,
it's dangerous.
I'm gonna make an insane correlation here, but our cat
Yes.
No, but this is something
Yes.
that I would have never thought of. And the only reason why I thought of it, well, I didn't even think of it, is because you brought it up. He was having urinary tract infections and he's a male cat. So why, like they say it's like 1 in 1,000 male cats will get this. It was like such an odd sort of infection that he had in his literal blood, like in his like
Urinary tract. And then I saw that he had a very infected tooth, and you're like, oh, well, obviously the infected tooth is causing this issue, because why else would a male cat have this often urinary tract infections? And we got the tooth extracted, which I still don't understand why you couldn't do it. That's something you're going to have to learn for the future. And then now he hasn't had a urinary tract infection in months, since August, and he was getting them he was on antibiotics from March until July. Because he was getting them regularly, and as soon as the tooth was out, he was healed. Yeah, it's just we
Which
just
goes
don't
to
link
show.
all of these things. You know, there's so many links that we have today.
I think they're linked because the food never changed. The cats don't go outside. There's no reason.
But now that he
for
has,
this cat.
and he has nothing now. He has no urinary tract infection. He has nothing wrong.
So it's also for people too, I would imagine.
It's the same for
because
people, no?
I've had in my lifetime urinary tract
Mm-hmm.
infections, and it was like a bit chronic. I've resolved it now, but could it have been related to my teeth? Maybe. You never know.
Maybe.
Maybe.
I mean, I wouldn't.
you have to really like look at your life, I guess, and like
Ask questions.
Yeah, like take things away and like maybe change your diet and do certain things to really, if you're chronically going through something, I guess, to like really hone in on your
What could be what else
what's
could
going
be
on
going
in your body,
What
and
else
then
is
like
going on? Yeah.
speak to specialists.
I mean, you have to think too, how can bacteria get into your body?
Right.
There's one way
Yeah.
that it really gets in. It's through your mouth. you
Yeah.
know? So when you have bleeding gums, it's not a normal thing.
Yeah.
And that is an entry point for bacteria. You inhale trillions of bacteria in your mouth a day. We don't often have cuts, and our skin is the number one protector of our body, as we know.
As we know.
But where is there a major opening is our mouth. And if the bacteria hits the back of the tongue and then gets to the stomach acid, you're okay. But if it bypasses that stomach acid through your gum disease, it enters the bloodstream. And then I would go all the way to associate it to urinary tract. I mean, why not? But
It could. It's just I'm saying. It's
Well,
something
like
to consider.
Maybe for a female is different. Like I would be, but like for a male to be getting urinary tract infections is like so
unusual. More unusual.
Yeah, it's more unusual. It's not as common. It's very much common for women to get them. That's why I was like, what the heck's going on here?
could definitely be related, because since we extracted the tooth, the cat has been better.
Well, thank
There
God for
hasn't
that.
been one
Thank God
issue.
for that. Now
Thank
you just
God.
you gotta get your dentist license for animals.
I mean, come on.
I could have done the
it's a
Could have been a
mouth.
whole business.
A mouth
Could
is
be
a
a whole
mouth,
business
no?
model. You know.
Well, yeah. They apparently say that once you have one infected tooth in a cat, there's more likely to be more.
Well, it's the same with humans probably too. It can spread out. No.
Good.
So, and did you know that they actually recommended that we brush his teeth and get a special toothbrush and a special toothpaste for him? And you have yet to do that. That's okay.
He really doesn't care about the cat's Tash.
No, I want to bring it back to, like, we're talking about different things that can happen when you don't take care of teeth. How can you throughout your life maintain a healthy habit and to prevent your teeth from getting to a state of, when you're in your elderly stages, prevent really big issues that I think you can talk to about my great grandmother. But like, how do you throughout your life, what are daily habits that you can do
To mitigate it.
to mitigate this?
And to also protect and preserve, right?
Yeah, preserve your teeth.
I think we're good in the sense that where society has reached, and most people will brush twice a day. Flossing has gone up. Flossing is excellent.
Thank God. There's
And
more reason than just dental hygiene to floss.
And for myself, I add in one or two mouthwash shots, I guess, a day, because why not kill 99% of the bacteria in her mouth? It takes a bacteria and a sugar and tooth structure to create a cavity. So if you're eliminating one of the
Contributing
contributing factors, you're less likely to. I mean, is that why I haven't had a cavity in a very long time? I don't know. Is it because I'm a dentist? Maybe, but In general, it's also inevitable. I mean, it's why the profession is going to be around forever. It's tooth decay is the number one disease worldwide. And it's because we use our teeth all the time, and we have the right hygienic approach. I think the other thing is you have to go to the dentist twice a year. I mean, ideally 6 to 9 months you're being seen. And when the dentist sees something that they want to repair, you get it done.
If you can, yeah.
If
you're lucky enough to, because there's a lot of places that don't. But what about like
Absolutely.
diet, for example? Obviously sugars,
Like, are there other
Coca-Cola.
factors?
I remember you told me also that Red Bull is one of the
Terrible.
worst things because of
Orange
the pH.
juice.
Yeah.
Orange juices, anything that's
You
drinks with
want to
sugar.
avoid acidity in the mouth, right? So what has a very low pH? We're talking energy drinks for sure. Coca-Cola, notoriously, lemon water.
Yeah, I was going to say lemon water, this big trend. Are you seeing a lot of people coming in with problems?
Sometimes I'll see some erosion on teeth, and I'll ask a few questions, and if they are lemon watering,
Lemon watering.
lemon watering early first thing in the morning without brushing your teeth. Yeah, a lot of the problems that we see also in the elderly is a side effect of medication. So
Also, yeah, that's true.
if you sometimes it happens in a 40-year-old that they're taking heavy medication, but in the elderly, when you're taking more medication, a side effect is xerostomia, which is a lack of saliva. So also adults, when we're sleeping, we have much less saliva in our mouth, like that dry mouth. What happens there is it's easier for bacteria to cultivate on our teeth, to eat away, to chew away at our teeth, and to create this phenomenon of tooth decay when there's less saliva. So in the elderly, that's one of the main reasons why they have more issues, is because your auto cleaning mechanism, your saliva is down.
It's
I didn't even
very
think about that medication would have something.
Yeah, but I was going to ask you also, so people that go through cancer treatments, chemotherapy, and all these types of things, their teeth really struggle too?
Yeah. Usually we'll do a teeth cleaning more often, maybe every 4 months, especially like before the treatments.
To kind of prep.
But yeah, when you have radiotherapy, when you have chemotherapy,
It's hard.
saliva is greatly affected, and then the teeth right away. And
Is there something that they can do, like mouth
increase
washing,
saliva?
just water in the mouth?
there
and
are
like swishing?
saliva supplements like biotin and stuff like that.
Okay.
But some help, but I mean, there's nothing better than your own saliva to clean your teeth. It's more important than brushing your teeth.
Yeah. Wow, very interesting. Yeah. So I wanted to talk about, well, first we wanted to also talk about the like the psychological effects of having a nice smile. You know, you had mentioned that, Tash, when we were discussing this
we
episode.
approached it a little bit when you were talking about if you like lose a tooth and your bone structure changes and your wrinkles and your self-confidence. Like self-confidence, I mean, besides the whole health factor of teeth, which is probably the main priority, there's the aesthetics of teeth and how it makes you feel and the confidence. Do you see major confidence shifts when people come in and out of your office? Like people feel better after a cleaning, or you see them significantly worse because they just got a tooth pulled? Like, what's the process?
Or your opinion on that, or what you're seeing also in trends.
So in my office, I see it not as much for my brother's an orthodontist. So when you have someone whose teeth are not aligned, sometimes that's a major complex. Could even be
Buck
just
teeth
a one rotated incisor that could cause
Cause issues for the entire life.
Yeah.
Especially after lied to for years.
Stop it. Stop it.
I didn't bring it up. He didn't.
but we do see it. If someone needs to get a tooth extracted, no matter what age, and it's in the front and it's in their smile, like it's immediately the conversation. I had the conversation with a 91-year-old woman last week, and she's like, and it was her last tooth in her smile.
Oh my
On the
God.
plate.
It's so cute.
And she was like, you can't extract my last tooth. And I'm like,
She was like in a
have to.
relationship with it.
yeah, we kind of have to. But
Oh, my heart.
but sometimes they'll just get a denture, which functionally is terrible. It moves. You can't eat certain things. It's difficult. But just the fact that they're able to
Have
smile
teeth,
and have teeth brings their confidence level to the moon. And it is very important. You know, you don't want someone running around blocking their mouth every time that they're smiling or laughing, but it happens. And I have the conversation quite often. And sometimes too, you'll see a young 22-year-old woman who has a beautiful smile, natural smile, and she'll come in and she'll say, I need my teeth whiter. And it's like, and I need them straighter and whiter. And then, you know, so there is an adverse effect too to the whole confidence thing, right? Is sometimes they'll look at themselves in the mirror and not love their smile that in fact
That
is
is
natural.
perfect. Yeah.
Everybody wants a perfect smile.
Well, it seems to be something that's very popular right now. Veneers, more and more than ever. People that have beautiful teeth. You can see celebrities, for example, where they were. You know, you see before and afters all the time. They show that kind of stuff, and I have that in my algorithm because I had my teeth.
But it makes like it genuinely does change the way the person looks. Like a lot. I mean, unless they're going for like that insane Mr. Clean white tooth look.
Yeah,
which
it's
I know
almost like Mr.
It's
Clean.
like, oh, okay, they've had veneers, but like if you get a really good job or you have a good doctor who does a good job, like your smile significantly.
Well, I can talk from personal experience
complete.
on that because when I was 10 years old, I broke my teeth. My front teeth broke in half, and I remember the feeling. I was so insanely upset about it. It took me months to get over it, but I went and I had caps put on. So basically they just, you know, didn't put like just they built on the tooth that was left down, and I broke them. I can't even tell you how many times in my life. I also crazy glued them back on when I would break them in a soccer game or whatever happened. And over that I was 10 and I had my teeth redone last year. So we're talking 40 something years. I learned how to smile without ever showing my teeth unconsciously. And then one day I was like, why don't I just get my teeth done? You know, why don't I just go and check it out? So I talked to my dentist about it and she recommended me to this guy, and I went in and I had, 6 of my front teeth redone so that my smile would be cohesive. And I tried to make them look like they naturally would. But the thing is, when I looked at the before pictures and the after pictures of my smile, I can't even believe I lived with those teeth for all those years, not even, but I learned how to adapt. That's my point. So I never had a self-confidence issue, but I would never smile with my teeth.
Subconsciously you had an
but
issue.
I didn't. I was unaware of it.
So you learned how to smile your teeth without your teeth showing. And now it's different.
Like,
and now it's different, but it really helped me a lot.
It's a difficult conversation for a dentist to have too on the other side. Like your dentist could have told you that you could repair your teeth and it could fix your smile. But if you don't bring it up to the dentist, like I'm not going to usually look at a patient and say, do you want a whitening?
No. Yeah, no, I get it. It's like, it's the same thing when we see people with their skincare. We ask them what their concerns are because I might see something on them, but if that's not a concern of theirs, I'm not going to bring it up because I'm not going to reinforce people's insecurities or make them second guess. Or,
I don't like that. I find that's a bit of a nasty sales pitch.
It's terrible, actually. It's not good for our society in today's world but all I can say for me is that I adapted. And I never questioned it until one day I questioned it, and it's changed my life. So it does have a big impact on confidence if you're able to do it.
Yeah.
You know, it does.
Yeah, for sure. I see it very often. I've done some, I mean, you only had 6. I've done some full mouth cases where I do even 17, 18 of the veneers or crowns.
Well, I'm planning to
What's the difference between a veneer and a crown?
It's just the amount of tooth structure that you
like
leave.
One's a cap and one's like a...
Yeah, so... I don't know what the word cap means really.
No,
but let's say
just on top.
Just on top, or like a tooth goes in and like
a veneer is like a let's say like a frontal
cap.
We'll say a fine cap. They're both porcelain. They're both made out of the same product.
But they don't last as long. Apparently, depends how much veneer you have on your teeth too, right?
Depends.
Yeah.
Depends if they do like an incisal capping of it, and a crown is like 360
I had the crowns done. Let me tell you something. When I was having my teeth done, I had nubs and I was like touching them with my tongue.
I would freak out.
I thought, oh my God, I can't even. He says, do you want to look at yourself? I'm like, absolutely
not. No, that
not.
would send me into
absolutely not.
Douglas.
I mean, he made it a very pleasant experience. I'm really happy with it. I'd like to do some more also. hint, hint, hint. But anyways, no, it's if you can do it, it's definitely a game changer. And if it's a concern for you, that's the most important thing.
That's the most important, right? Is that there are options. Like, for example, a lot of patients will also ask me, can you do composite bonding, which people call bonding, which is just a veneer done with white filling. And for myself, there's some dentists that are phenomenal, the work that they could do out there. But for myself, I find I'm limited in terms of the colors. I'm limited in terms of the shape. And it becomes, it's very, what I think is going to be really, really nice with my hand and artistically creating the tooth might not necessarily be what the patient finds to be the best shape and the best color and this and that. So I tend to refrain from composite bonding veneers and will go more with the porcelain route when the patient is ready, because they last a lot longer. They won't chip. They won't.
Yeah. And you have also a, you can with today, they can take your smile and then they can put teeth on and make you look like it's like a virtual. You see yourself with the teeth, so you can choose. Well, I don't know what you call it.
We do a digital scan, and then what happens often is we'll order a wax up. Yeah. So it'll be like a rock model of your teeth waxed to what exactly they'll look like shape wise. So
you can get an idea, and you can say, no, that's too long, too short, whatever. Exactly. It's a very pleasant experience overall. Yeah. So I just want to get into, now we understand like the what kind of like the lifelong journey for teeth, and what I think, what was really shocking to me was when with my grandmother, your great grandmother, and what she had to go through at the end of her life with her teeth. I mean, she was part of the war generation, so like already she had a lot of her teeth removed, but they discovered when she was in a full care facility towards the end of her life that she had teeth that were literally rotting in her mouth, and we had to have them extracted. Now, when you have an infection in your mouth at that magnitude, it can, I'm assuming, have all kinds of effects on the body, including like accelerated confusion and influence on dementia and stuff like that, which she had. But they couldn't freeze her properly even.
Mm-hmm. That happens.
They couldn't freeze her. So I just think that we need to be bringing more awareness around elderly people and their teeth, because there's a lot of suffering going on, silent suffering that they don't know how to verbalize when they're no longer
capable
or completely cognizant. And it contributes to a fast decline, I feel like.
It's also like if you're an elder person and you're in a home and then someone is responsible, or if you have dementia, you're probably going to forget to brush your teeth. I mean, I don't know, but I assume that when they're going to bed at night, they're not brushing your teeth, right?
Yeah.
And then you add the other medications they're taking. So now you have the xerostomia. So now you have no saliva. Yeah. Who knows what their nutrition actually is in their diet?
No, and oftentimes they're eating like soft foods. They're no longer chewing anymore, so they don't choke. And there's a lot of things.
So there's a lot of factors that go into this degradation, and then they can't vocalize that they have a small tooth pain. So we only really see it when it's a big infection. And like you said, a difficulty freezing is because an infection is so acidic. And if the patient can only be brought once because you need transport care, you need one of those handicap taxis, they get transported to the clinic. Now they're there in that moment. To send them home with antibiotics, to then come back the following week, sometimes it's a bit more difficult. So we'll do the care on the spot if they can come back. So now they have not taken the antibiotics. Now you're going to freeze, highly acidic. The anesthesia product is very basic. So an acid-base reaction causes like a burning sensation. So the freezing really, really hurts a lot more than normal. And it gets neutralized because the acid neutralizes the base. So the anesthesia doesn't work profoundly, doesn't work deeply, doesn't work well. You're not going to inject this unfortunate 90-year-old person with 5 caps.
No.
Carpals to like try to get it more frozen. It burns, it hurts.
It's just terrible.
It's horrible. Mm-hmm. But it's all a cascade, right? And how can you, are the social workers working at the old folks home supposed to go in and brush the patient's teeth at night? I don't know. Is that part of their? I don't know.
I don't know if that's part of protocol.
I don't know.
Well, it probably should be.
I think it should be part of protocol, but it's also a family's responsibility. But unfortunately, what I witnessed was there was a lot of elderly people that didn't have family visiting them.
No,
They're really alone. It's very heartbreaking.
sad.
And so there's nobody that's really taking care and checking that these things are being done. And I mean, as a family, we did, but we still missed that.
Because
We
you
missed
don't know.
that.
You
That is like the part where I find we just need to bring more awareness to families and people who have elderly
Yes.
people that they're caring for, or parents that are in assisted living facilities, to look out for those things,
They just can't forget to go to the dentist.
and also
It's the
to
most
check their
important.
mouths, make sure they're brushing their teeth, make sure that,
But even if you don't have a control on that, like let's say your mother lives in another city than you, and,
Yeah,
and,
it's
and
unfortunate.
maybe you feel bad and you'd love to be there for your mom, but you're in Toronto and your mom's in
Of
old folks
course.
home in Montreal, and you try to place her in the best home. I mean, the most important thing is that the patient still gets dental care, right? That they still show up to the dentist, and we can see when a tooth is going to be infected. Like I'll tell patients when they bring their parent, like, look, that tooth in the next 6 months
it's
to a
gonna be
year,
trouble.
2 years, this
Yeah.
is going to cause a lot of pain, serious issues. Like, let's just extract it now. Like, we're
Okay.
here, right? Like,
So is there any, are you aware of any kind of dentist services that is available to elderly people, that they actually go into those homes, those assisted care homes, and do dental work on the spot there? Do you ever heard of that?
oh, no, but it's
Actually, it could be an idea, eh?
I don't know. I don't even know how I would bring my equipment.
No, I know that's the thing. That's the thing,
Oh,
because
the
it's
equipment.
complicated,
We
right?
never know. We never know what we need. Like, I could
Or just to be
extract-
able to go and check people's
The mobile
mouths
dentistry
and
truck.
then
yeah, mobile dentistry.
no,
truck,
but I
like,
mean, it is an issue. It is an issue. I saw it, and
But
it was heartbreaking for us.
we can't attempt to do a procedure.
No, not like that,
without-
but to go into homes, to be able to look at the patients, all the people that are living in these homes, to actually look at their teeth and say, this person I need to see, this person I need to see, just to identify.
probably be 100%.
Oh, really? Oh, yeah.
That bad.
Then I
It would
just
be
think
100%.
ultimately there needs to be more education within a family to be like, okay, my mom's approaching the age of 80
Yeah.
or 70, like
Yeah.
making sure that those appointments are still booked. And then if the elderly home comes into play, making sure that there is a proper protocol within that elderly home that
Just
actually,
bringing awareness.
yeah, like it's just bringing awareness to that, because we take care of our baby's teeth. Like eventually they're going to take care of our teeth when we're older.
Well,
you
we
know?
come in to this
a
world as a
cycle.
baby, and we go out of the world as a baby, so
Well,
to speak. They
my
always
el-
say that.
My elder patients with the best hygiene or the best work done normally have kids. I put an S on kids that are able to share the tasks of bringing them to the dentist. So I'll often meet all of their children, right?
Yeah.
There's 3 or 4 children that are bringing the mom for multiple appointments in that particular little, because it happens quickly, right? Where they come in for an emergency, tooth broke, I'm in pain, blah, blah, blah. And then we need to see this patient for like 2 or 3 appointments in the short term. And then you have 6 months till your next cleaning, a year till your next cleaning,
Yeah.
whatever. But usually it happens like
It's condensed.
it's condensed. And then, but normally the patients that come in with children that are taking care of them have a better chance at
You
having
hear
their
that,
teeth.
Natasha? Joey,
I got you.
expect to be
I
taken
mean,
care
your
of.
grandparents are thriving with their
Oh
teeth.
my God,
for sure.
they are so cute.
Yeah. At 92, he's still driving. I mean, thankfully, I work 2 streets away from his house, but he comes to all his appointments. He's there often.
It's good. Like it's
Yeah.
very, that needs to be happening
Yeah.
more often, just so that like you're in that stage of your life, you're not in pain, you're not like
Suffering. It's already hard enough.
It's already hard enough to get older and to be in that and like have some of your freedoms taken away. And
It's also quality of life, right?
100%.
If you can't eat a corn on the cob anymore ever again, but that's something that you really, really like, well, then your quality of life has been affected.
Yeah, 100%. Well, this has been great.
Thank you.
yes.
A lot of fun. I like
love
doing
it.
this in person too. It's
Yeah,
a
it's
lot
much
more
better.
fun. But we do have 3 questions that we always ask every guest. And I'll let Natasha ask the first question.
What is one thing you wish everyone did daily for their teeth?
Floss.
Yeah, no, it's good. One word answers, straight to the point. What's one thing you tell someone who's afraid to go to the dentist?
Get over it.
Oh, okay.
Okay.
Or
All right.
go see Dr. Joe Scalia at his clinic,
Get
and
over
he'll
it.
make sure that
If
you get over your
if you
fear.
can get an appointment.
I heard you're very good with people
I try.
and very good with children.
Thank you.
Okay, so finish this sentence. A beautiful smile is.
A beautiful smile is everything.
Oh,
That's
so cute. Mic
sweet.
drop. Love it.
Thank you so
Thank
much
you
for
for
today.
coming.
It's been a pleasure. If anybody wants to go see Dr. Joe in person to get their teeth cleaned, where can they find you?
I work at 4659 Jarry East in St. Leonard, Montreal.
Amazing.
Call for an appointment and they should give you a cleaning by August 2026.
Exactly. Because I'm still waiting, Joey.
It's coming.
Much in demand.
Thank you.
Thank you so
Excited
much.
for our third episode, whenever that might be.
Yes.
Thank you.
Thank you for listening to Skin Talks.
If this episode inspired you, taught you something new, or just made you feel seen, please share with someone you love. And if you believe in thoughtful and empowering conversations that help you make better choices for yourself around your beauty and wellness, please rate and review the show. It helps us to grow our community, and we deeply appreciate it. Because this isn't just about skin.
It's about claiming your beauty, feeling strong, informed, and at home in yourself.
See you next week.